Dear student, good morning. These few slides remain from the ECG lecture 2. I'll cover them now. Conduction defect. The conduction defect of the heart means either we have a defect in conduction in the sinoatrial node, or in the AV node, or in the bundle branch, which is called bundle branch block. So if the conduction is in the AV node, so in the conductive system of the heart, in the AV node, in the AV node or main bundle of His, it will cause heart block. And the heart block has 3 degree, which is called first degree, second degree, and third degree heart block. Or we can say it has 2 types: incomplete heart block or complete heart block. The incomplete one, why it means incomplete? Because all the P or atrial depolarization blocked to the ventricle, some of them reach, or in the first degree all of them reach, but there is prolongation of the PR interval. So the only abnormality in the first degree heart block is prolongation of the PR interval. So the PR interval is prolonged because there is conduction defect. There is AV abnormality, but it causes conduction from the atria to the ventricle. In the second degree, there could be a block, 2-to-1 or 3-to-1 block, means 2 of the atrial, there is 2 atrial contraction, 1 ventricular contraction. So, or there is 3 atrial contraction while 1 ventricular contraction. So not all the way from the or electrical activity from atrial reach to the ventricle. The complete heart block, which is called third degree heart block, here there is a complete dissociation between atria and ventricle. Each one of them has its own rhythm, which is called idioventricular rhythm. In the bundle branch block, means either right bundle or left bundle become blocked, and there will be wide QRS complex. This is an important feature of them. So as we said in the first degree heart block, as you can see, what happened? There is prolongation of PR interval. So if you look at the PR interval, how you can calculate it, or how you can know the duration from the beginning of the P, as you can see marked with purple color, from the beginning of P till the beginning of R. If there is Q, from beginning of P till beginning of Q. So PR interval means from beginning of P till the beginning of QRS wave. So what you will see here, the PR interval is prolonged, although here the small squares are not so obvious, but as you can see, the large square, there is a more than 1 large square, the PR interval. What's mean by more than 1 large square? It means more than 1.2 millisecond, 1.2 second. هما نوتمان هر large square يك 0.2 second. أما large square يك لقل 2 small square يترقى زيادة. So if PR interval become more than 0.2 seconds, it's abnormal. It's called prolonged PR interval. So it means there is conduction defect in the AV node. Okay. In the second degree heart block also has 2 types. They have a complex name, or the difficult name. I don't want to confuse you with this name. Let's come only to know what are the difference between these 2 types of second degree heart block. One of them is there is the type 1 of the second degree heart block. There's successive prolongation of PR interval or progressive prolongation of PR interval. سيريكا PR interval والله چنکه ورد زی کردو لیرا بابا چن بابا 9 small square سيريكا لیرا یکم جار چن بوا یکم جار 6 حوت small square ورد زی کردو. There will be progressive prolongation of PR interval until there is a drop beat. and she drop beat PR interval later on a prolonged beat QRS nabini. There's no QRS, there will be drop beat. So the PR interval, there will be progressive prolongation until the wave doesn't reach to the ventricle. That's why it's also called block. Or another type of second degree, or the second type, there is no progressive prolongation of the PR interval, but there is drop beat. ليه PR interval is prolonged نبوه سيري كان يعني ايش progressive prolongation PR interval ما نبوه بلام there is drop beat. It means there is P wave without QRS. Can you see? There is P wave without QRS. So this is also second degree heart block. In the complete heart block, this is the complete. Means the خوي calling heart block يعني atrial contraction or atrial depolarization يعني electrical activity negative ventricle كdepolarization نجيش يعني طبعا دوايش contraction نابه ليه شو مزانين بطاطي complete heart block ولا أني ترى هني بيت أجيشت ياخد بس prolongation منها بلام ليه there is complete dissociation يعني none either we have P wave without QRS and we have QRS without preceding P wave. So when AV conduction fell completely, atria and ventricle beat independently. It will called AV dissociation. But if you can see, we have regular QRS interval and regular P. يعني atrial depolarization and ventricular depolarization regular. يعني لحمان كاتا بيا كان دوباره بوتو سيري كان لحمان كاتا QRS كانش دوباره بوتو. Why? Because each one of them are beat independently of the other. There is AV dissociation. سيري كان ليرش عيني شد. We have these the P أو black arrow يعني هم pin P without QRS and QRS without P. So this is complete or third degree heart block. What about left on bundle branch block? Bundle branch block means if there is a block in one of the bundle left to right band here. He can block. For example, when left bundle block means you have left bundle branch block. There will be widening of the QRS. Some pattern man here, the left to the right, RSR pattern. هو دواي إخواني بيزنا كابتشينا ديتيلوا. What you have to know now, for now, there's widening of the QRS. As you know, QRS should be about 0.8 to 0. تقريبا هو 0.8. باشترك ل 0.8 تزيحترنا به. When it's more than 0.10 or 0.12 in the QRS, in the left bundle branch block, it reach to even to 0.12. So it becomes very wide. More than 0.10, it's called wide QRS, and mostly one of the cases is bundle branch block. MW shape معناها WM shape معناها كملشت معناها كبيدة أنا نسيتها وقفت شرع بوشي widening QRS رؤية. This is important. Why there is widening of the QRS in this bundle branch block? If you can see, we have here the bundles. Bundle can man here لذاك right to left bundle man here. And if there is block, for example, in the left one, there is blockage man here. What will happen there? We have blockage in this bundle. So the wave of depolarization comes to the right ventricle. Here there will be depolarization, and there is no depolarization here. How depolarization here in the left side take place? After the ventricle reach the wave of depolarization reach here, then the left ventricle become depolarized. It reached the wave of depolarization from the right side, so there will be delay or in the depolarization and later also the contraction of the ventricle. So what will happen? There will be widening of the QRS, and here comes jar چیە بێت depolarizationی ڕایتە بێعنی وەکەوە ئەو سا ئێمەمەوە بەیەکەوە synchronized contraction between both sides of the ventricle بەڵام ئەمە یەکێکیان خەریکە depolarize بێت جاوەی تر depolarize بێت so there will be widening of the QRS complex. Okay. أما bundle branch block which is common as we said mostly seen with MI acute MI يكسر لهاني بالbundle branch block در كسيدي كان widening of the QRS complex throughout the leads الحمو ليدا كان لفيا كان جوان تريشي بيني أو تلا ليدا كان يلم ليدا كان شا جوان ديارة. Let's come to ventricular hypertrophy. Ventricular hypertrophy, it's easy, you know. We said why QRS has higher amplitude than the or higher potential voltage or higher amplitude than the P wave because the ventricular wall, the cells are more, so more electrical excitability. The sum of the electrical excitability is more. So when you have also higher than normal electrical excitability or amplitude of the QRS complex, then by this you will know that the ventricle is hypertrophied. طبعا هو calculation خوي هي مش حسابي كيكا اس ل V1 حسابك هي لقل R ل V5 حسابك هي تو تشي كي كويا كي تو بس أنا يشان لارج سكوير باش تريك كلا حود زياتر نبيع لو حالتها أقل لو زياتر بولا حول لارج سكوير this is ventricular hypertrophy. This is roughly you can calculate that, and you can see by eyes there is lengthening or increase in the amplitude of the R wave. So means more cell depolarize, more electrical excitability. That's why higher amplitude, and this is due to what? Due to hypertrophy, ventricular hypertrophy. What's cardiac axis? We discussed the cardiac axis of the heart, and we have axis deviation. This is the normal cardiac axis. If it is go away from that, it is called go toward the left. It's called left axis deviation. Go towards right. It's called right axis deviation. If it is within the normal, it's called normal axis deviation. Normal axis. قلت عن ليه بجاري أما normal axis شنكه مالين تقريبا ناقص 55 أما ناقص 55 گۆشەکەی بەڵام ئاگاتان لە یەک شت بێت ئەمە ئەڤەرێجەکەیەتی بەڵام ڕێنجێکمان هەیە لە ناقص 30 بۆ زائد 100 کێشەمان نییە. If within this axis, this is normal axis حتى ئەگەر لاشی ئەبێ. But if it go beyond this, it is called left axis, right axis, and so on. Okay. ئەگەر سەیرێکی ئەمە بکەین بۆی ئاسان بیناسینەوە کە چۆنە. We have to look at lead 1 and AVF in order to know if it is left axis deviation or right axis deviation. Lead 1 ئەگەر positive بوو يعني چی؟ يعني the QRS بۆ سەرەوە بوو QRS complex بۆ سەرەوە بوو زیاتر positive بوو and AVF or lead 3 is positive, it is normal axis. Okay. If lead 1 positive while AVF or lead 3 negative يعني زيادة بخواره بو أوجه left axis deviation. If lead 1 negative while AVF or lead 3 positive, this is right axis deviation. Both of them negative, extreme right axis deviation. You can see in the this figure. This is normal cardiac axis. How do you know? Because lead 1 is positive, lead 3 is positive too. طبعا we have to calculate this downward deflection also. ناقصية كيكا positive زورتر لان negative أو حسابية كي چند سكوير بوسر وروجدو چند سكوير بخوارو هاتو ناقصية كيكا positive زورتر با positive حسابية كي. Okay, so this is normal axis. هو يلويا axis كيكا حسابية كي. This is right axis deviation. How do you know? You can see lead 1 is نيجاتيف سيريكا ليد 1 نيجاتيف زيادة بخوار وهاتوا يعني قد نقصيكي زيادة بخوار وهاتوا نيجاتيف ليد 2 sorry ليد 3 positive كاتا right axis. This is left axis deviation. As you can see, lead 1 is positive, lead 3 is negative. بمشي ويا axis deviation كان حسابه كيف أمانة لا كاتي practically شادواي لا clinical skill إخوانا. Okay. Electrolyte disturbance on the ECG. Of course, you received how hypokalemia and hyperkalemia are dangerous. You also hypocalcemia and hypercalcemia, how they are affecting the membrane potential or the excitability of the cell, and how they can affect also the action potential. Hypokalemia checker, both hypokalemia and hypocalcemia, they cause prolongation of the QT. As we said, QT prolongation is very important, and it will calculate it from the beginning of the Q till the end of the T. wave man here. This is QT prolongation. كزيادة الهايبوكاليميا دركيو. Okay. هاي electrical activity خوي بركنجي فايبرة كم جعل normal دركيو لا هايبوكاليميا زيادة pronounced. أماتشي hypocalcemia. There's also QT prolongation. بلام hyperkalemia hypercalcemia بعكس shortening QT interval. باشا طبعا electrolyte abnormality تنها أودوانا ناقلية وشي ترمانه. We have sodium abnormality also. We have abnormality in the magnesium. Hypomagnesemia also make QT prolongation. But these two are more important and more common. That's why we discuss these two. If you can see that of the potassium abnormality or hypokalemia and hyperkalemia, there's T inversion, but this T inversion is illusional one. What's meant by illusional one? It seems to be inverted because there is a prominent U wave. U wave وعليك توك T wave وكو inversion تركب. So there is ST depression. أماتشي hypokalemia. While in hyperkalemia, there is hyperacute or peaked T wave. Hyperkalemia هي peaked T wave and PR as you can see PR prolongation. There is PR prolongation but shortening QT. QT short wide QRS change here. The most important one, the one that I discussed, the prolongation of QT in the hypokalemia and calcemia. أما hypercalcemia or hypocalcemia. Hypocalcemia, as we said, prolongation of the QT, while hypercalcemia shortening of the QT.